This is the external jugular, internal jugular. The brachiocephalic is this area from here to here, the innominate or brachiocephalic. And then this is the external jugular. This path is going to the subclavian, into the axillary, and down into the brachial region. So you could follow this and get all the way down into the arm. Okay? And you can even cut out some of this rib if you want to get it out of your way. The internal jugular, external jugular, the subclavian right here, which becomes the axillary, which again, get down into the arm, would be called the brachial, but it's the same tube. Here's a little bit of it that we cut it and ripped it out at some point. On the other side, I haven't looked at that, but you can uncover this and probably again see the innominate or brachiocephalic and the jugular and subclavian that come off of that, the junction just like they did here. This is the common carotid, and there's probably another one on this side, the other left common carotid.
Does it go up to brain?
Yes, that goes up to the brain. And those are branching off of underneath this. The artery, you can see here, this path is the common carotid, and this path is the subclavian. If you follow it along, becomes the axillary and the brachial. That's that junction right there. And below the junction and connected to the heart, from here down to where it's connected to the heart, is the right innominate or brachiocephalic artery. And on the left-hand side, there'd be a vessel that has the same type of format right here. So you can uncover that on the left-hand side. It's the same on both sides. It's symmetrical there. If you look again at the back of the heart, look for the dorsal aorta. It's coming along, and I just pulled all the tissue out of the way and cut free where it was going through the diaphragm. And the first road, first off-ramp off of the dorsal aorta is this one. It's the first major path. That is the celiac trunk. And come back to the dorsal aorta and look for another major off-ramp. It would be this one, which is the superior mesenteric artery that's serving the mesenteries. And you can go back again, find the aorta. This is like some lymph node right there. Anyway, and find the aorta. An easier way to do it is just to lift the kidney up, and you can find the renal artery and continue down that descending aorta. Pull it up and out even. On this cat, I did see a gonadal artery, but it had been severed. And then this also was severed. This is the inferior mesenteric artery. Below that, you have the junction of the external iliac arteries, one going to the right and the left for each one of the appendages. And right here, the internal iliac arteries.
Can you see those, or?
Yeah, they're right here. They're not on your list, I don't think, but they are visible on this cat. In the venous system, below the heart, everything is inferior vena cava, as long as it's below the heart. And it's the inferior vena cava that passes through the diaphragm here that is attached by renal veins to the top of the liver. It may be difficult to distinguish a renal, I'm sorry, not a renal vein, hepatic vein, the liver. You can see the inferior vena cava below the liver, right here. You can follow it down. You can see it again here. On the there is no superior mesenteric vein. Instead, there's the hepatic portal vein. Again, we won't identify it in terms of the dissection, but you should look at the images that you have of the liver and be able to pick it out of one of those images. The only major path off of the inferior vena cava is the renal vein, which is easy to identify, attached to the kidney. And then when you get down into this space again, in this case, the arteries on top of it, you can see the big junction here into two separate paths. That's going to be the external iliac vein, one for the left and one for the right. Okay? So that's all you have to worry about as regards the circulation here. Just those few things. Okay? Is this